So, Nirmish, how does sickle cell affect the individual's quality of life? You mentioned the complications, you mentioned the different organs that could be involved. What does that say in terms of their functionality and ability to do their ADLs every day?
Yeah, I mean, I think that that's a big portion of what we sometimes overlook. And I think that as providers, we really have to be aware of the idea that quality of life is an issue that affects every aspect of their life. And in the sense that, for example, patients are in the hospital, and pain being the #1 cause for hospitalizations, patients are in the hospital unexpectedly for long periods of time. It disrupts their family, the care for their children. So there's a lot of aspects of this disruption that lead to problems with their quality of life. So I think the other aspect to consider here is that when patients have cognitive issues, visual impairment, hearing issues, that adds another layer to problems that cause problems with quality of life. So I think there are a lot of problems that we really need to consider, and I think that having these issues which are unexpected, unplanned, lead to a high rate of anxiety, depression, and even attempts for suicide. And I think that if you don't ask the questions, you're not going to know.
Absolutely.
And so I think that's a really good point that you brought up.
I'm going to ask about a touchy subject, right? So most human beings, when they get to adulthood, enjoy sex, right? And sickle cell is not any different than everybody else. And so as a female with sickle cell disease, have you heard from your patients, Bree, any sexual challenges that they've experienced because of their sickle cell disease?
In fact, I have. I'm glad you asked that question. So sickle cell disease, by definition, produces an anemia. And I have heard a lot of my female patients talk about the degree of fatigue associated with the sickle cell disease, and presumably because of the anemia, or at least in part due to the anemia, and their inability to really have the energy for sexual activity. It's not something that we talk about enough, I think. And then in terms of males, I don't know if you were going to ask this question.
I was going to ask Matt.
Oh, go ahead, Matt.
Well, as a pediatrician.
Actually, before you say that, I want to say something else that I've learned about women, is that the other thing, sickle cell, it's a vascular condition. So at the end of the day, the blood can block the blood vessels, and it can destroy the blood vessels. And I've seen some women who actually are able to have sex, but often have a vaso-occlusive crises caused by having intercourse, presumably because of the significant increased blood flow. And it's something really important to recognize because it can be very painful.
The other thing that we've noticed is menstrual-induced pain,
Very
difficulty with
big problem.
pregnancy, high risk of mortality and morbidity during pregnancy or after
40%,
pregnancy.
40% of females have pain and vaso-occlusive crisis before, during, or after. And again, you have to ask. Otherwise, they feel like that's a normal part of having their menses.
And being pregnant is risky. There's a high mortality for the child and the mother. But I want to circle back to the male sexual challenges that sickle cell individuals have. Not to pick on Matt or Nirmish, but tell us about how does this affect male sexual function?
So one of the complications, vaso-occlusive complications of sickle cell disease is priapism, the unwanted and painful erection that can occur. And this is related to blood flow into the penis that is a relatively hypoxic organ with disordered blood flow, non-vascular blood flow, that leads to a change in the cell shape and a problem with blood leaving the penis, and therefore the penis becomes erect and won't go away. And so this can happen spontaneously, most commonly, usually in the wee hours of the night when there's a combination of mild hypoventilation and REM sleep. And the combination of those two things can induce a erection, normal nocturnal tumescence, but that can then trigger an unwanted persistence of that erection and a painful erection. And the problem with that is that if that lasts too long, this can lead to damage and ultimately fibrosis to the penis that then leads to the inability to have an erection when you want one. And so impotence is certainly a concern, as is with the compounding recurrent nature of it. Often you're seeing lots and lots of sclerosis and scarring leading to megaphallus and all sorts of other problems. So that can be a problem for many men with sickle cell disease. And even this is something that probably is under-recognized in the fairly young population of boys.
And I think it's important to know that this is a complication because the treatment should be available to these patients even though they do have sickle cell disease. So they should have access to all the ways of treating erectile dysfunction that everybody else has access to.
And it goes back to, just not to interrupt here, but is to go back to asking the question.
Yes.
Right.
You ask about quality of life, you ask about anxiety and depression, you ask about having sexuality issues, priapism. If you don't ask the questions, you don't realize it's a problem.
And they suffer in silence.
And it's very true. And, a lot of men give me a pretty funny look when I need to discuss their erections and their sexual function, and usually I get a little bit of a wrinkled face, and then they're like, well, you know, I'm glad you asked, because, you know, my doctors before never thought to ask me that question.
And it's a problem, and that can lead to a lot of family dysfunction and, you know, marital dissatisfaction, et cetera.
And, you know, we didn't touch on fertility.
Yes.
Not just the fact that there's difficulty with pregnancy, but some individuals have a lot of trouble becoming pregnant. There's issues with both men having insufficient sperm production, or azoospermia, but also women who have had some difficulties having regular menstrual cycles and therefore being able to become pregnant.
I know way back in the day they used to do hysterectomies for people with sickle cell disease because they were afraid that they couldn't carry a pregnancy to term. Nowadays, again, whatever is available to everybody else should be made available to this patient population to help mitigate these complications.